We're now going to do a brief overview of dissociative disorders. These consist of dissociative amnesia, dissociative identity disorder, which is also known as multiple personality disorder, depersonalization or derealization disorder, and then of course is the basket case for conditions that do not neatly fit into any of the others. So the clinical characteristics of a dissociative disorder are, number one, there's an alteration in consciousness. Person's awake, but is somehow detached from their surroundings. In essence, the person is hypnotized, but it's an auto-hypnosis because no one else has hypnotized them. Usually this follows an extremely stressful event that's associated with feelings of shame, guilt, desperation, and conflict. There's comorbidities of post-traumatic stress disorder, borderline personality disorder, and conversion disorders such as pseudo-seizures. So dissociative amnesia. So here's where a person cannot remember something. That can be they can't remember an episode, for example, a single traumatic episode such as a rape, and the person can't remember the details. Generalized, where a person forgets their entire life story. That's also known as the dissociative fugue, which we'll talk about shortly. And then selective amnesia is when a person can remember some of what happened, but not the full course of events. And then a systematized dissociative amnesia, when, for example, I have a patient who, from the age of about 7 to the age of about 11, was repeatedly sexually molested by a male babysitter, and she only remembers vague details, almost no details at all, but she knows it's something that she was sexually molested. So she has this systematized dissociative amnesia. The clinical features, so localized amnesia can actually be delayed. Initially, a person can remember what happened, but in the next few days, weeks, or months, the person can forget what happened. And it can be more than just a single event, it can be multiple discrete events. Generalized amnesia is dissociative fugue, which we'll talk about, sudden onset, and lasts a very long time. And the prognosis of amnestic memories varies. In many cases, an acute traumatic episode, car accident, or sexual assault, the person initially can't remember anything, but over the next few days, the memory starts reappearing. So amnesia can resolve rapidly or gradually over the years, or not at all. The patient I just mentioned who had these repeated molestations by a male babysitter, still after years and years and years of psychotherapy, remembers very, very little about what had happened. She remembers sitting on the washing machine while she was with him, and she remembers being in the elevator with him and being scared about what he was going to do to her. But other than that, does not remember what exactly happened. All right, let's look at a case here. A 54-year-old man with a motor vehicle accident. His helmet was damaged in the accident, but he was found to have suffered no significant head trauma and no loss of consciousness. That's what LOC is. He talked with a friend after the accident, but he had no memory of the accident or of the 12 hours afterward. His first recollection was a friend telling him, "You crashed my motorcycle." He borrowed the motorcycle from the friend. When he returned the next day to the hospital where he'd been treated, he recognized the nurse as someone familiar, and she told him that he'd been yelling when they treated his injured left knee. But the visit did not stimulate any direct recollection of his time in the hospital. He recovered no memory of the accident a month later. Now, what about a 30-year-old woman who was beaten and raped by a man who drove her home from a party? She refused to let him enter her apartment, but he returned a few minutes later claiming he had to make a phone call. He then sexually assaulted her. She screamed and struggled and called the police afterwards. The man was arrested when he returned to retrieve some jewelry she had pulled off his neck during the struggle. Although she did not sustain a concussion, she began to lose memory of the rape in the ensuing week. By the end of the week, she had no memory of the rape, but became listless and depressed, In psychotherapy, hypnosis was used to help retrieve her memory, and she was gradually able to do so. Consequences of these traumas can include impaired relationships, self-mutilation, suicide attempts, and a host of other psychiatric disorders as listed in this slide, primarily post-traumatic stress disorder. So dissociative amnesia can occur there's a differential diagnosis of several other medical disorders. A seizure, a person will have no recollection of the seizure itself, but also during the post-ictal phase, they may have a fuzzy recollection of what actually happened. Head trauma, which we showed in one of the previous cases. A blackout from a night of heavy drinking, a person has no memory of what happened. Korsakoff's amnesia, which is permanent damage to the mammillary bodies and the hippocampus, results in an anterograde amnesia. Certain strokes can affect memory of events, and then postoperative amnesia, often because a benzodiazepine midazolam is given during conscious sedation, and this benzodiazepine, like alcohol, causes a complete blackout for the event. This happens during colonoscopies all the time. Females greater than males, probably because they're more likely to be traumatized. All right, now, generalized dissociative amnesia is also known as dissociative fugue, a fascinating but rare illness, but I thought it'd be very interesting to kind of talk to you about it. Person doesn't remember even who they are, and it can last for days, weeks, months, in some cases years.
Man found wandering in a Seattle park with $600 in his sock, no ID, and no idea who he is. Well, it turns out that he has led a fascinating life, but can't remember most of it, including his own lyrical name, Edward Lightheart. He is speaking out now for the first time since his frightening ordeal began, and ABC's Neil Karlinski has details from Seattle.
He's been called a mystery man since showing up at the Seattle hospital 3 weeks ago wearing an expensive shirt and sports coat, telling doctors he doesn't know himself.
This is definitely not a hoax. This is one of the most hellish experiences that anybody can go through.
After his story was published in the Seattle Times, friends around the world came forward to identify him as Edward Lightheart, a highly educated world traveler. He says the name doesn't ring a bell.
It's like a jigsaw puzzle with pieces all over the place that don't have any interlocking joints as of yet.
His wedding ring triggers memories of the wife he lost during childbirth. His most recent memories are of walking around this park in Seattle, staring at the trees, confused.
I recognize Seattle, but I have no idea how I arrived here or by what means.
He's been described as an intellectual, fluent in 3 languages.
From an objective standpoint, this is absolutely fascinating. But from the subjective standpoint, it is absolutely terrifying.
Even though he now knows his name, Edward Lightheart says he prefers to go by the name John Doe. A woman described as his sister tells the Seattle Times he has a history of emotional problems and of sometimes disappearing for years at a time. Doctors are hopeful his memory will return, but they're still not sure what triggered the problem.
It's a lot of confusion, a lot of frustration, because I'm remembering bits and pieces here and there that don't fit. There's no chronological fit. There's no mesh to what I know.
He isn't only confused about the past, but the future, too. The man who can't remember says he has no idea what to do now. For Good Morning America, Neil Karlinski, ABC News, Seattle.
And for more now, we're joined by Dr. William Lukowski. He's a neurologist at the Swedish Neuroscience Institute, where Mr. Lightheart is being treated. Thanks for joining us, Doctor. Such a fascinating case. He has a fantastic resume online that people have come across, some of which seems a bit exaggerated. And his sister says he spent much of the recent years sitting in his room until they had a falling out. Is there a chance he could be putting us on?
Oh, I don't think he's putting it on at all. I think the mind can do fascinating things. I think what we hear here is somebody who's very gifted, but at the same time, I think things are just not going well for him.
We see in the movies a blow to the head brings this sort of thing on. How does this come about? Could it be a gradual decline?
Well, I mean, I don't think we really know the kind of life history that he's had in any detail, but I think what we're struck with is that he's so very able to describe the fascination, in a sense, which sounds like something that comes out of a novel, but at the same time he's able to express how very concerning it is and how disturbing it is when memory comes back to him.
And now he's being bombarded with all these amazing facts about his own life that he has no recollection of. How do you treat a person like this?
Well, I think the first thing I think you sort of come to grips with is that in the electronic age, all of the memory is sort of forced upon him almost instantaneously. People from all over the world are saying, I know you, I've met you, I've taught you, you've taught me, and so on and so forth. But I think to confront him with all of that, which we've sort of done in a way, sort of is disturbing to him. I think he's able to describe the fascination he has with the idea of not knowing who he is, but also at the same time the very disconcerting feelings he has when these memories are sort of foisted upon him all of a sudden.
It is really a fascinating case, and we appreciate your insight this morning, Doctor. Thanks.
Sure, thank you.
Personally, I believe this is a conversion disorder, but come up with your own ideas about what you think it is. So differential diagnosis is pretty much the same as what we discussed with other forms of dissociative amnesia. Very rare. It's found more commonly with a war and natural disaster than with a human-associated trauma. And as opposed to other types of amnesia where it's women more than men, here it's men more than women, but you don't need to know that. Treatment, psychotherapy. A patient can be hypnotized, and if doing hypnosis without a drug doesn't work, one can use a barbiturate called amylbarbital, which is injected intravenously, light sedation, and the physician can then try to help elicit the memories from the patient. This can also be used diazepam, benzodiazepine intravenously can also be used for this purpose. All right, the next one is dissociative identity disorder, which is multiple personality disorder. Here you've got two or more distinct personality states which exchange control over the individual's behavior. There's usually a dominant personality, and then there are the ancillary personalities. The dominant personality may know nothing about the other personalities and will have no recollection of what happened during the time that the other personalities took over. The vast majority of patients with this disorder have been the victims of sexual and physical abuse in childhood. Their different cells have different memories, and the personalities even have some of their own physiologic reactivity. The differential diagnosis, schizophrenia, bipolar disorder, I would also add borderline personality disorder. In fact, there is a belief that multiple personality disorders doesn't really exist, but that certain patients who've heard about this end up convincing themselves that they have it, because we all have different parts of our personality. But if a individual who is already fairly sick, like someone with borderline personality disorder, spins off those personalities into kind of other people, they can kind of convince themselves, just like in a conversion reaction, they can convince themselves that they've got multiple personalities when they really don't. I give you the epidemiology that's found in the DSM, but 1% of the population is absurd in my opinion. This is extraordinarily rare. I think I have seen 2 cases in 30 years. Both were in medical school.
Sybil, how do you feel? Not at all well. Ever since I was little, I've been sick, but not... What do you mean? People say I do things that I haven't done. Like what? Well, Sometimes I'll meet people I've never seen before who say they know me. And sometimes I'll find clothes I don't remember buying hanging in my closet. Or a painting I've started. I'll come home and find it finished. Only in a completely different style. You're just trying to trick me. Lots of people trick me. Lots of people, just like they trick them. I mean me, like they trick me. Me.
Who are you?
Sybil.
No. No, you're not.
You can tell the difference.
Oh, you bet. You bet I can. What's your name?
Peggy. Peggy Lou Baldwin. We don't look alike, me and her, but most people can't tell.
Is that your sketch, Peggy?
Uh-huh. I like to draw in black and white because I don't paint as good as her.
Oh, I think it's very good. It's very, very good. Oh, you know about her.
Yes, I do. I know what everyone does, especially Sybil.
But you're not Sybil.
Mon Dieu, mais non. I'm Victoria. Victoria Antoinette Chalot. I was born in Paris, but one becomes Americanized after a while, so please call me Vicky.
Well, how do you do, Vicky?
Très bien. But Sybil is not. She worries all the time. Like now, for instance. She doesn't like it when I buy things.
Oh, so those are yours.
I put them on the charge card, but Sybil tries to take them back. It's too funny.
How long have you been around, Vicky?
Oh, since Sybil was très jeune. I was the first, and the others came after.
What others?
Sid and Mary and Peggy and Oh, you don't know about them, do you?
I've met Peggy. How many are there?
16. There's 16 of us.
Okay, now the most common of the dissociative disorders are depersonalization and derealization. So depersonalization is a feeling that one is outside of one's body. It's an extremely common experience. Derealization is the feeling that suddenly nothing around the person is real. I don't know if any of you have had those experiences, but I remember, especially in adolescence, I had experiences of the world isn't real or I'm not real. So very common. This didn't cause me any distress. It was kind of more of an existential experience. But this can occur in a whole range of disorders. So it's common during trauma. So if you've had a really bad motor vehicle accident, you may have experienced where while it was happening, let's say you were hit by another car and your car tumbled over. People who've gone through this experience will report that time goes very, very slowly. Even though the whole thing may last 3 seconds, time goes very, very slowly. And while it's happening, they feel like they're outside of their bodies, or they feel like it isn't even real. Panic disorder during a panic attack, many people experience these things. And then this can be substance-induced. Borderlines commonly have many, many experiences like this. And then all these other medical conditions can cause these experiences, and I've listed them here, just like I've listed this pretty much similar ones in the earlier slides. Women greater than men, and doesn't always have to be treated unless it's really troubling to the person. And again, we only diagnose this if it doesn't occur within the frame of another psychiatric disorder, such as panic disorder. So people can have these as just distinct entities in the absence of another psychiatric disorder and can cause them great distress. Okay, that concludes my brief overview of dissociative disorders.